Niko hapa.
General Stadion! Present! Good morning, sir. Morning. Protocol mounted by Prison Staff Training College, formed up and ready for inspection. So please.
Basi Protocol Commander amemwomba ruhusa mgeni wetu rasmi ambaye ni Cabinet Secretary, Ministry of Interior and National Administration, Professor Kithure Kindiki, ambaye tayari hako nasi katika hafla hii ya handing and taking over. Karibu sana ya ufunguzi rasmi ya hospitali.
End of inspection, sir. May I have the permission to dismiss the protocol, sir, please? Stand number 1, stand by! Remain thus in the guard room. Dismiss!
Orientation of Wanini Kireri Magereza Hospital. This is a level 4 hospital with a bed capacity of 150. For the design of the hospital, it has different spaces, the outdoor and the indoor spaces. For the indoor spaces, first, you have the main hospital building, which is 3 levels, whereby it encompasses the main hospital departments. On ground floor, predominantly we have the outpatient departments, that's the consultation rooms, the radiology, physiotherapy, and the laboratory. West of the facility, we have the utility block and the other support facilities. For the utility block, we have the backup generators, the medical gases, also
The laundry.
yes, the laundry, and also the other elements encompassing medical gases and biomed.
This is the first where we perform our first stage of labor, which consists of from the onset of labor until the mother is ready for delivery. We have a bed capacity of 6, and after we monitor our mothers 4 hourly, we are able to admit them now to the delivery room, then we can proceed to the delivery room. We can be able to conduct 2 deliveries at a go, sir. And this in a day, within 24 hours, we can be able to carry out 10 to 20 normal deliveries, and we monitor our mothers here. Thank you, sir.
We can install our dialysis unit, 2 points. The same unit, we need only one analysis to monitor the patient, and one central to monitor the unit. We can be able to monitor all the 6 patients.
Basi wanapobadilishana tuwashangilie kwa makofi jamani, makofi. Tupige makofi. Makofi tena. Unapo saini kesi zile mbili, unapo baadaye kubadilishana. Haya, ni wakati wa kupata Nashukuru sana.
It is very humbling to have you with us today during this official landing and taking over of this level 4 Wanini Kireri Magereza hospital. This hospital was constructed in a record 9 months after the groundbreaking ceremony presided over by the former President, Honorable Uhuru Muigai Kenyatta. As Kenya Prison Service, we will always remain indebted to the government of Kenya for the so many reforms initiated and accomplished. We have been facing challenges of our officers assessing specialized treatment. Now this will be a thing of the past, thanks to this noble initiative to construct this hospital. The hospital will serve as a referral for health qualities we have in the prison facility. Therefore, it will have the capacity to cater for all the cases which need specialized treatment. In the recent past, the service recruited medical personnel who underwent and completed the prison officers training. A number of them will therefore be redeployed in the hospital to provide much needed services. We commit to take good care of this facility as a way of appreciating the many deeds the government has done for this service.
We sincerely thank the Ministry of Defense for this occasion, for building for us this premier hospital. We commit that we shall maintain the hospital in the highest possible standards. We have a staff strength of over 35,000, and we hope, together with their families, bringing a total of more than 120,000, together with the neighboring community on referral basis, we shall be able to keep this hospital very busy. We thank the Ministry of Defense for the collaboration in helping us to train our technical staff and their commitment in agreeing to bring personnel to us. We hope that we shall maintain the hospital in the highest possible standard, and we thank the friendship and the partnership that we shall continue having going forward, so that we are able to give the best quality of healthcare to all our members of staff in the Kenya Prison and the State Department for Correctional Service in general. We will not be reinventing the wheel, and so we will build on the lessons that we shall learn that are tried and tested in the Ministry of Defense. And already we have a technical team which is going to come together so that they can be able to select the ideal personnel to run this hospital. We commit and we undertake that we shall not lower the standards at whatsoever going forward. And we thank you again. We also thank the contractor for the good work that they have done. We thank her for making sure that the main instruments and the main machinery that is required to kickstart the hospital are in situ. And we thank you that you've agreed that moving forward, we shall ensure that all the remaining machinery shall be brought into place.
My colleague peers and myself, and you have given instructions that although we are handing over, work starts now. This hospital must be operationalized to support the prisons and the security sector. I want to assure you on behalf of my colleague peers that from tomorrow, from this Monday, we shall meet with my colleague peers to find ways and means of the Ministry of Defense and KDF supporting this hospital so that it can be fully operationalized as you have directed. I want to thank you.
I am delighted today to be part of this historic handover of the Magereza Hospital by the Kenyan Defense Forces to the Kenya Prison Service. This hospital is one of the premier medical facilities that we continue to develop to assist our men and women in uniform, as well as their families and other stakeholders, including members of the public, to get access to high standard and high quality medical services. It is important that I thank C.S. Duale, our Defense Minister, the Kenya Defense Forces fraternity for being so magnanimous in terms of supporting the construction of this facility on behalf of the Kenya Prison Service. The reason we made a decision as the Ministry of Interior to request our brothers and sisters from the Kenya Defense Forces to support us with the construction of this hospital, and even going forward to support us as we operationalize this hospital, together with the other hospital which we are going to be taking over today, that is the National Police Service Hospital in Bagathi. The reason we requested our brothers and sisters from the Kenya Defenses to support us in the Ministry of Interior, there are two reasons. First is that the Kenya Defense Forces within the security sector has the longest history with running, management, and operationalization of health facilities. They have a long history, and therefore they have developed impeccable capabilities and capacity to be able to set up and run medical facilities. And because we are all one in the security sector, we found no reason why Kenya Prison Service or the National Police Service should go looking elsewhere. So we turned to our brothers, and government decided that because this is primarily a health facility for a security organization, it was the position of government, the Kenya Defense Forces, having a long experience in this health and management of health institutions, should do it on behalf of the other organs of our national security. The second reason, of course, is because within the security sector, we are one unit, we are united. We have different mandates, but our common objective that puts us together is the security and stability of our nation. And therefore, the organs of internal security and our Kenya Defense Forces that are responsible for the defense of our nation, we have one common objective, and therefore we must always work together whenever there is an opportunity. And therefore we felt KDF, therefore, is the natural partner for Kenya Prison Service. And I'm very delighted at the very, very cordial, warm, and friendly engagement that has taken place during the construction of this facility. We will continue to foster partnerships, friendships, and comradeship between ourselves and Kenya Defense Forces, so that we build public trust and public confidence in the organs of our national security, that we are all working together. We have one purpose, one objective, one mission, which is to make our country safe and secure. And therefore, my brother C.S. Duale, Vice CDF, and the other senior officials of KDF who are here, I want to assure you, on behalf of my colleagues, my PS here, Sally, and the other senior officials, including the Commissioner General of Kenya Prisons, that this relationship is not ending at this handover. The relationship is not ending at this handing over. It will continue. We do have some capacity in terms of medical personnel, but we will need additional capacity. And our first point of call will be the Kenya Defense Forces before we look elsewhere. So we have directed, my brother and I have directed that the two principal secretaries, P.S. Patrick and P.S. Salome, will work together, of course, with the rest of the team, to make sure that the collaboration between KDF and Kenya Prison Service in the running of this hospital is concretized, so that when we need specialist consultant doctors who are available by within KDF, they should be able to support us. I want to underscore the need for us to maintain good standards. I have already directed PS Salome and the Commissioner General of Prisons to ensure that we do not compromise on the standards, the quality standards, including cleanliness that we have seen here. We have state-of-the-art equipment, medical equipment, which is already in place, and we want to put in more equipment. And the building, the facilities look great. But in this country, we have a problem of maintenance of public institutions. There is something that we have not gotten right as a country. That is how to manage public institutions and public facilities that are clean and of good quality. And if you are asked the difference between a public hospital and a private hospital, is only one: cleanliness, standards, and maybe how we treat the people who come for services. The culture, our ability to present ourselves well. So we must work towards maintaining those standards. The facilities must remain in the quality they are in. It is easier to spend a little money every year to maintain the standards than to wait until the building and the facilities are dilapidated and we are trying to pump in money, lots of money, to bring them back to standard. So I really hope we'll be able to make a difference. And again, I have been to the facilities run by our brothers in KDF, and I think we can model from them and benchmark and be able to do a good thing. Now, finally, is to just say that we have also agreed with my counterpart, CS Eden Duale, that we will be, again, in our facilities, reaching out to the surrounding communities and general members of the public. So we're going to have some way where members of the public around here, even if it's on a referral basis, can get some access to this facility, because this facility is primarily for ourselves, but also we want to build good rapport and trust with the surrounding community. That is going to be our policy even for the other institutions, including the National Police Service Hospital, which will be also taking over today.
First and foremost, I extend my heartfelt gratitude to the brave men and women of our security forces, particularly the Kenya Defense Forces and the Kenya Prison Service present here, for their unwavering dedication and service to our nation. Your commitment not only to safeguard our borders and upholding law and order, but also contributing to the socio-economic growth of our country does not go unnoticed. We recognize and appreciate the sacrifice you make and the risk you face daily to protect human life, property, and uphold the rule of law. The establishment of this facility is a testament to our government commitment in providing quality health care services to all its citizens, including those who serve in our national security agencies. This initiative is part of a broader health care program aimed at ensuring access to essential medical service. Our notable institutions under this program include the National Police Service Hospital along the Mbagathi Way, which me and my brother, Minister Kindiki, will visit later today, and the Forces Referral and Research Hospital which is under construction, level 6, under construction in Kabete Barracks. And that is a hospital, the level 6, that will become a regional referral hospital, not only for our security organs and our citizens, but for our regional partners and allies in the security sector. With a capacity of 150 beds, 2 major theaters, and critical care units such as accident and emergency, ICU and HDU, maternity and dental services. This facility is equipped to cater to the diverse health needs of our community and members of our security organs. Furthermore, I'm pleased to announce that the hospital is designed to be friendly to people with a disability, encompassing accessible entrance, washrooms, circulation areas, ensuring there is inclusivity for all. A healthy population is not only essential for individual well-being, but also for economic prosperity. The lessons we learned from our experiences, including the challenges posed by COVID-19 pandemic, underscores the need for robust welfare facilities to support our service personnel, their families and veterans at a time when they are defending the safety and security of our citizens and making sure that our country is safe, secure and stable. Indeed, the welfare and the morale of our security forces are paramount in enabling them to fulfill their duties effectively. At the Defense Headquarters and at the National Security Organ personnel, myself and Professor Kindiki, under the guidance of the Chairman of the National Security Council and the Commander-in-Chief of the Kenya Defense Forces, we are focused to make sure as our men and women spend a lot of their time in defending our country, in making sure the rule of law is maintained, our borders, both interior and outside our borders, are secure. We will make a deliberate effort to make sure that there is a robust housing program for their families and themselves. There is a robust health care for them and their families. And there is a good education system for their children. Those three provided by this administration, our officers, whether in interior or in deep operations, will have a focus on the enemy and making sure that as they defend our country, as they protect our country, their families, their children access good health care, live in a decent housing, and they can go to good schools